Good morning there, Mr. Johnson. Put her there. Nice to meet you, sir. My name's James. I'm the PA student. I understand you got some new diagnoses today, so I'm just going to explain those to you. Does that all sound good? Okay, sir, so before I explain these diagnoses, I got to make sure that we're on the same page about how your heart functions. So let's take a look at my diagram of the heart here. Oh, I'm sorry, sir, that's actually the incorrect picture. So here, there we go, here's our heart diagram. If you're looking at the blue side here, that's the right side of your heart. Its responsibility is bringing the blood from your body, sending it to your lungs to get more oxygen. Then once you have oxygen in your blood, it's going to come through the left side of the heart here in red. Now, if we zoom in a little bit here, you can see that there's actually valves between the two different chambers on the left side of the heart. Our left side, the left ventricle, this muscular chamber, is going to pump hard and send blood through our aortic valve right here. Once blood goes through there, it makes its way to the aorta, which is a large vessel right here in your chest. That's going to allow the heart to supply blood to the rest of your body, so it's very important. So just to make sure you're following with me, any questions? Is that all making sense? So now that we're on the same page about the heart, let's talk about aortic regurgitation. Once again, the left side of this heart is going to send blood through this aortic valve up to the aorta, through to your body. Now, if that aortic valve is not working how it's supposed to, like a door, it's not closing in between each pump, and it's working like a leaky door, some blood is going to flow back into your heart. Now, this extra blood flowing into your heart is going to lead to that section of your heart stretching out. When it's all stretched out, it can't pump as well as we want it to. So if it's not pumping as well, it's not getting enough blood to your tissues, to your heart, that's going to lead to some symptoms you might be experiencing, like just general fatigue and tiredness, some chest pain, or even as the blood backs up, it can back up into your lungs, cause some fluid to leak out there called pulmonary edema, and that could cause some shortness of breath. As well, since we're not pumping all the blood out, this could lead to heart failure, which is the next diagnosis that I'm going to explain here. Are you following along with me? So this brings us to your other diagnosis, heart failure. Now, heart failure can be caused by a multitude of different diseases or other reasons. And in this case, aortic regurgitation, like what you're experiencing, can be a cause of heart failure. Heart failure is just what the name says. The heart is failing as a pump. So when we're having the heart failing as a pump, two things are going to happen. Your body is not going to be being supplied with enough oxygenated blood, and your veins, which are draining all that deoxygenated blood back to your heart, are going to fill up with fluid. Now, when you're not getting enough oxygenated blood to your tissues, that might cause symptoms that you could experience like chronic fatigue, chest pain, confusion, maybe some impairment of your memory. When we're seeing the other side of things, the fluid overload, as all that fluid backs up into your veins because your heart can't pump fast enough, we're going to see things like we talked about with shortness of breath due to pulmonary edema, that fluid in your lungs. We're also going to see edema building up in your lower extremities, in your legs. Those veins far away from your heart, they're going to fill up with fluid, and that fluid, when it's too full in the veins, it's going to leak out in your tissues. This could cause your legs to look swollen, pink, shiny, and tender. Okay? Does that all make sense? Well then, Mr. Johnson, glad I could explain this stuff to you today. Hopefully you're leaving with a better understanding. Now let's get into some of the treatment options. You know, this isn't a totally hopeless condition. So what we're going to want to do here is